Jesse Noyes here, VP of Marketing here at Tebra, and I'm joined by Kevin Clinton, our Director of Billing and Payments Product Marketing. And really interesting story that was in the intake that I wanted to chat with you about, Kevin, because there's an interesting kind of divide that's emerging when it comes to payments specifically and the issues that Gen Z is running into that perhaps uh, baby boomers are a little more like a nerd to. Immediately saw this and I was like, oh, I want to know it, get some of Kevin's thoughts on this. We see here, we had this was in our roundup. Anyone who wants to get great content about all kinds of issues affecting private practice, I highly recommend the intake on Tebra.com and signing up for the newsletter because our Vital Signs newsletter has some really great content. But I was really struck by this, that Gen Zers want less payment friction in healthcare. And this was the stat that really got me was nearly 7 in 10 Gen Z patients encountered at least one issue when paying for their most recent healthcare service compared to fewer than 1 in 5 baby boomers, right? And so this is a huge issue of friction for them. It was really interesting to get into the data here and see like what was causing this issue or why do we think this issue is happening. One of the reasons they feel that this is happening is because the baby boomers use like in person a lot more versus whereas Gen Z was moving more to telehealth. Um, Additionally, Gen Zers are often, when they do go in person, they're kind of like, oh, you don't have like a digital payment option that I would experience online,
Sure.
whereas the baby boomers maybe understand that. The other piece of that that was really interesting here was that they're finding that baby boomers, they're often paying for those services through Medicare, right? And there's a more streamlined process for dealing with any kind of insurance issues as they come up and the payments around the insurances between the carrier and what you owe the practice versus what the carrier owes. Whereas there's a lot of the Gen Zers either have no insurance or they're dealing with like their own insurer privately without, that kind of streamlined process of Medicare. And they had backed this up with some data from the CDC, which found that 26 million Americans last year didn't have health insurance. Nearly all of those were under the age of 65. So it's primarily a below baby boomer and really pronounced within the Gen Z groups. I thought this was really interesting how the divide is emerging in terms of like the just ability to pay, struggling to figure out how to pay, and that need for kind of a digital option. You're wrapped into everything payments all the time, thinking about it every day. I'm
Yeah.
just kind of curious of like what you make of this issue and what you think private practices might need to do if they want to keep providing services not only to the baby boomers and the millennials, but to this new cohort that are rapidly needing more services across a variety of different practices.
It's interesting for sure. I think a couple of things you probably have going on too. You have baby boomers who've kind of been accustomed to that. They're pre-digital kind of their whole lives and using medical insurance and payments more accustomed to that. And then you have, the Gen Z who were raised in the digital economy. So look, they're looking for similar experiences like they would have on Amazon or using Apple Pay. And in addition to that, I know clarity is often earmarked as something that's difficult for that group as well. So tools like our patient statements is like making them very clear explanation of what your benefits are, what your insurance is going to cover. And then we drive those patients online as well. So again, we're driving back to that digital payment experience. Payment plans is something that's big for that group. A lot of Gen Z are using telehealth services, mental health, which is online. So reoccurring payments and things like that is really important to that group. Convenient payment options. So like optimizing for mobile, the ability to get a link on your mobile device and within a couple of clicks make that payment is very important. Setting up some sort of automation for payments, like we have automated patient billing reminders. They're not checking email as much and certainly not rifling through their mailed statements that are probably sitting up on a desk somewhere. So it's keeping that payment reminder front and center, but really optimizing for digital, making it easy to understand the bill and making it easy for them to pay the bill. I always say if somebody's trying to give you money, make it easy for them. Reducing that friction out of that whole process is what they're used to. I think Amazon's kind of led the way at that. So healthcare has been catching up and adopting to doing kind of the same thing.
Yeah, thinking about this problem from the perspective of, what we're used to seeing whenever there's a consumerization happening with new technology over time. I think very often you're used to the older generation maybe struggles to adopt new technologies and therefore run into all these snags, and the younger generation's kind of native to it. But I think what we're seeing in this situation is almost the inverse. Not because they're struggling with the technology, like they understand how to use a telehealth service, they understand how to pay digitally, as you noted in the different payment plans. But, a lot of the healthcare providers and the system that they're working with the carriers is not necessarily set up or have adopted that technology as readily. And so it's just kind of not set up for people who are used to, on a consumer front, paying for things
Sure.
digitally. Right. So it's an interesting kind of inverse correlation happening in the industry there, and kind of caught me by surprise. It's just funny to think that like you have like a 20 something, they might struggle to pay their doctor bills, but be explaining how to use like the phone to their dad. Or just an interesting switch.
It is. You do have those baby boomers that are really tech savvy too. So you kind of have the best of both worlds. They're used to analog and kind of mailed statement and really deciphering their bill. And then, once they're on board with the technology, then you have a powerhouse there too. It's really, making it seamless, streamlined, taking out friction, explaining what the patient's going to owe, and making it easy for them to pay. Especially in like the mental health arena, there could, present some friction between the provider and the patient. It's kind of a delicate area. So if we can automate those payments, kind of make sure they run in the background, and make it easy to sign up for that recurring payment or make that payment, just makes it easier for the provider and the patient.
Yeah. Thank you for giving us a little
Yeah,
of your
sure.
education from the expertise there. Love talking about it. And, if you're a provider out there, you're probably wanting to look at digital payment options. We're definitely one of them. Thanks for catching us up, Kevin.
You bet.
Appreciate it.
Thanks, Jesse.